Now, a live News 7 KWWL special report. Coronavirus. Facts, not fear. With Ron Steele and Abby Turpin.
I would like to begin by announcing some important developments in our war against the Chinese virus. We'll be invoking the Defense Production Act just in case we need it. In other words, I think you all know what it is, and it can do a lot of good things if we need it.
HHS is issuing a regulation today that will allow all doctors and medical professionals to practice across state lines to meet the needs of hospitals that may arise in adjoining areas.
Late developments from the White House today. Good evening, everyone, and thanks for joining us here tonight live for a KWWL special report, Coronavirus Facts, Not Fears. I'm Ron Steele.
And I'm Abby Turpin. Several big announcements from the Trump administration concerning the coronavirus today. Over the next half hour, we will be talking with local health professionals, asking the big questions that are important to you.
And as the coronavirus concerns spread across our nation, the number of cases right here in Iowa, unfortunately, slowly continuing to rise a little bit.
We have learned that there are now 38 reported cases in the Hawkeye State. Among the 9 new cases we've learned about this evening, 3 are in Johnson County. 3 more, I should say, are in Johnson County. Washington and Wenatchee counties are reporting their first cases. The World Health Organization declared the coronavirus a pandemic last week. The number of cases continuing to grow, with more than 214,000 cases worldwide now and nearly 9,000 deaths.
So tonight here in this half hour live, I want to discuss many topics. Let's introduce you to our 3 panelists right now. First of all, Nafisa Sisi-Abonye is the Public Health Director for the Black Hawk County Health Department. Certainly you've seen her in our live briefings that we've been covering here the last couple of days involving coronavirus. Sarah Brown is a Vice President of Clinic Operations for Unity Point Health here in the Cedar Valley, and Dr. Matthew Sako is the Chief Medical Officer at Mercy One Northeast Iowa. So Dr. Sako, let's start with you. Limiting contact between people seems to be of critical importance right now.
Yes, it does. If we limit the contact, we limit the spread of the virus. The cough, the sneezing, even individuals who don't have symptoms can be ill and spread the virus. So the social isolation, the distancing do help a great deal.
Nafisa, I'd like to direct a question to you right now, and it's something that you said this afternoon in the news conference at 3 p.m. that we had right here on KWWL. It's actually something you said that at the time when you said it, Ron and I looked at each other and we were quite confused. You said, 80% of people who get coronavirus will have mild to moderate symptoms, so they could probably just recover at home. And you kind of actually insinuated that they should just stay home. But if we're keeping track of the number of coronavirus cases, shouldn't they go and be tested?
That's a very good question. The reason why we're asking people to, with mild symptoms, to stay at home is because even if they go to their providers and receive a positive test, they will be asked to stay at home. So there is no cure, there's no vaccine for coronavirus, and so that's why we're asking people to implement preventative measures already.
So let's continue that on real quickly, Nafisa. There are tests going on right now in Black Hawk County. Can you tell us how many tests have been conducted? How many are positive or negative? We know there's just been 1 so far positive, so I assume most of them have been negative. Are they still in progress, pending?
Yes. The Iowa Department of Public Health is not releasing the number of tests, and that is why, because there's an abundance of tests that is currently going on. And so at the moment, all we're receiving is the positive confirmed cases.
And Sarah, who should be tested? Do you think, from the Unity Point standpoint, as you're looking at this as an overview, as a Vice President of Clinic Operations there, who should be tested in this area?
I think that is the question that we are getting most often is who should be tested. We are currently following the Iowa Department of Public Health guidelines, and so that really is going to be, first, do you have symptoms? Do you have a cough? Do you have a fever? Are you short of breath? And then second, have you traveled to one of the CDC high-risk areas, or have you been exposed to someone who has a known COVID-19 case? We are following those guidelines and feel like we are testing appropriately at this time.
Great, Sarah, thank you. And another question for you, actually, Sarah, because I've seen this question a lot on our social media page, especially on our Facebook page. What about the people who already have appointments with their medical provider? Should they just go ahead and reschedule because this is such a confusing time for everyone?
I think it really depends on what you're coming in for. So if you are coming in for a sore throat or something that needs to be managed acutely, is what we would call it, and more quickly, we definitely want you to still come in and see your primary care provider. We also feel like we have a really safe place in our clinics currently, and we would encourage people to keep their appointments. If we get to the point where we actually do have a higher volume than normal, we may need to work through that, and that could mean that we would push physicals out a little bit if they weren't necessary, or rechecks. We're not there yet, so we would encourage people to still come see us.
So a real concern, I'm going to start with Matt Seiko real quick, or Dr. Seiko, and then we'll go to Nafisa about this, but a real concern that has been expressed to me is what happens if our local healthcare workers come down with this illness, as has happened already in China. Even the person who tried to get the word out, a doctor over there, has died because of coronavirus. What happens locally, and has it happened the case up in Boston? So how prepared are you, Dr. Seiko, here in the community to deal with that?
Well, what we would do is self-isolate that individual, put them at home for the 14 days, and monitor them if they were exposed. If they became ill or severely ill, like the physician you mentioned in China, then they would come into the hospital, might need ventilatory support, might need assistance that way, or other cares. So really only the ones who are very sick need to be in the hospital. Most individuals have a self-limited case, less than 14 days, and they will get better.
At a time like this, of course, it's the reason we're actually doing this half-hour special, because there's so many misconceptions out there, a lot of rumors flying around, because frankly, everyone is very worried right now. And one thing that people have been talking a lot about is the people that are wearing masks, because I've read a lot about this, because if you are actually not sick, it's actually not effective. Is that correct, Sarah?
That is correct. So we are really saying if you are sick, you should wear a mask. So that you don't expose others. And if the person you are caring for is sick, they should wear a mask, you should wear a mask. Beyond that, if you're not showing symptoms, there's not a need for people to be masking at this time.
Dr. Abonye, the HIPAA regulations really kind of limit what you can say at all, but we have learned, at least from a couple of sources, that the local Blackhawk County infected person is in their 80s. Is there anything you can tell us about that person, about where they are being treated, how the extent of their illness, if it's very serious, are they going to recover? But we do know that's in that category that is high risk for sure. So what can you tell us?
Unfortunately, I cannot disclose the details of this situation, and that is because of HIPAA, and so I cannot disclose that information.
Is there ever talk, kind of going along with that, because of all the questions that I've seen from viewers today on our Facebook thread, people are frustrated with that. Of course, those are HIPAA laws in place, so they have to be respected. But when we're facing a pandemic, a worldwide pandemic, something that most of us, this is the only time we might see this in our lives, is there a chance that at some point they might lift some of the rules on that? I mean, I think people want to know, like, where was that person the past 14 days? Did they go to a certain restaurant? Anything like that? Is there ever a chance that things could be changed? Nafisa.
Nobody wants to answer that. Okay. I don't blame you. I wouldn't either. But yeah, because your hands you're really hamstrung by that. Absolutely, yeah.
Yes, we are. We are, and we follow the Iowa Department of Public Health's information.
And I was also told that a lot of this is actually coming straight from Governor Reynolds, that she's in control of this, and she wants to be the person that gets everything out first. So there again, I hate to say there's politics involved, but a little bit. But the main thing is protecting Iowans. So that is the main thing that everybody is worried about right now. No doubt about that. How about the 3 C's? This has been common. We've been talking about this for at least 2 weeks now. So Sarah, the 3 C's are very important, starting with covering that cough, right?
That is exactly right. So that's where it's really, really important that if you do have a cough, it would be great if you can just stay home. If you can't, then it's really important that you do mask it, or if you cough, that you would cough into your elbow.
All right.
And the Blackhawk County Health Department, we've had this on many times already in the last 24 hours, unveiling a brand new website specifically to inform all residents, everyone, about the coronavirus right here in the Blackhawk County area. Here it is right there. It's blackhawkcovid19.com. And I noticed that you have the different elevations there right now at the yellow elevation, which means there is at least one case in the county with the community spread going across Iowa. And KWWL has been covering this pandemic, unfortunately, I guess we could say, extensively over the past few weeks. From the latest cases in Iowa to any questions you might have, all that information is available under our special coronavirus tab on KWWL.com. We're going to be right back here to ask and answer more questions in just a moment. Welcome back here live right now for our special program. So many events across the nation and even here locally have been canceled or postponed, citing those coronavirus concerns.
Canceling sporting events and festivals, and really any sizable event, is designed to slow down the spread of the virus. It is known as flattening the curve. Now, this is a precaution best described by this graph. If we were to let the virus run its course without any preventions, it would spike fairly quickly and sooner. However, it would overwhelm what our health systems are able to handle.
Unfortunately, not just an increase in the disease and in its range, but in the increase sometimes in intolerance and misunderstandings and conspiracies and bad information and things like that.
And of course, that's why we're doing our special reporting tonight, trying to educate everyone and stop the spread of the disease as well as the misinformation. While canceling the big events might be an inconvenience to many people, it also does help ensure that those most vulnerable get the treatment that they need. Now, if canceling all events accomplishes the goal of flattening the curve, it may look like we overreacted. That's essentially the point. So we're going to talk about this a little bit because we've been hammered for doing so much coronavirus. But Dr. Fauci, Anthony Fauci, Director of National Institute of Allergy and Infectious Diseases, says it's certainly going to get worse before it gets better. He says right now the mortality rate for coronavirus is 10 times that of the flu. So Sarah, let me ask you, what do you think about that? Because people have been saying, well, the flu is much worse. Yes, it is bad, but the mortality rate is greater at this point based on the current numbers, right?
I think Nafisa might be better to answer that question, but I think what I would say is we're in the business of taking care of people that have viruses all the time. And so we do whatever we can to prevent them first. And when they do get ill, we are prepared to care for them. As far as the mortality rate, I think I would pass that to Nafisa.
Well, in terms of just understanding the coronavirus, COVID-19, what people have to understand is that this is new. So there's ongoing studies that are being conducted. We also have to remember that it's flu season. And one thing that we know for sure is that flu has an impact on young children and also the elderly. With coronavirus at the moment, what we're seeing in studies is that it's mostly impacting the elderly population. So at this moment, I think there's more studies that need to be done to be able to confirm that statement.
Thank you, Nafisa. Dr. Seiko, I want to direct this to you. This is actually a viewer question we posted on our Facebook page, reaching out to viewers with the concerns that they had. And this one is about pregnant women. Have any studies been done on the effects on the fetus should the mom become infected with the coronavirus, even though it's so early on with coronavirus?
At this time, we have seen no studies that have shown the effects of a fetus from the coronavirus. It's still a new virus. We know that pregnant women do not seem to be a specific group that we're worried about, unlike the H1N1 in 2009, the swine flu, where young children and pregnant women were one of the biggest groups that were affected. So at this time, we're waiting to see what comes up.
Nafisa, another viewer question here right now. This is a pretty good one, I think. Here, why are schools closing but not daycare facilities?
That's a very great question. Right now, the guidelines that we're receiving is from the Iowa Department of Public Health, and they have indicated that the schools need to be closed. However, we need to also keep in mind that healthcare workers also have children, and we need the childcare facilities to stay open so that they can help us as we mitigate the spread of this virus.
All right, there are simple tips. We keep saying this over and over. Simple things, common sense, keep yourself healthy. Wash your hands with soap and water, at least 20 seconds minimum. If you can't wash your hands right away, then use an alcohol-based hand sanitizer that contains at least 60% alcohol. And avoid, we all do this, avoid touching your face often, particularly with your unwashed hands. And practice, if we're doing here tonight, we have people all over the studio, not here on the set, practicing social distancing. Avoid handshakes. That's something I'm having a hard time getting used to. I'll have to admit, I like to shake people's hands. Our panel discussion continues in just a moment. Stay with us.
Well, we cannot reiterate this enough. Local health experts are saying one of the biggest things you should do if you think you have coronavirus, you need to call for a phone screening before you actually go to your doctor. This will help staff determine if you need to be tested for the virus.
Now, you'll likely be asked about 3 questions at least to determine if you should be tested. And of course, one of those is, have you been traveling outside the country lately? Are you showing any of the symptoms? Have you been exposed to someone who could or does have the COVID-19?
And we welcome our panel back once again for this very important discussion that we're having. And I want to continue our conversation a little bit more on daycare. Ron had mentioned, of course, how schools have canceled. Why not daycare? But what resources are actually out there? I'm a mom, so I'm always wondering who's going to take care of the kids. So Sarah, if you could kind of tell us, what if I'm a parent right now and I have nobody to watch my child, but I still need to go to work? Let's say I'm a nurse. Who do I call?
Yeah, we always want to really make sure that we're taking care of our employees in a way that helps them kind of manage their life outside of work, you know, the same as they do at work. One thing with the schools being closed that has been a challenge for our team members that are working in healthcare is daycare. And so I'm really, really excited about the work that is happening in that area. There's a large community coalition that has come together to really help people find a place for their children to be cared for, because we need those healthcare workers to be at work right now.
Absolutely.
Dr. Seiko, Amazon arrives at my house about every day. So what about packages and mail? How should that be handled now with all these concerns out there? Should you wear gloves? Should you wipe it off with sanitizer? What are you recommending right now?
Right now, we know the soft surfaces do not let the virus live very long.
Yeah.
Coronavirus, COVID-19, is not a very strong virus that lives a long, long time on those surfaces. Now, hard surfaces, it does live for longer periods of time, and we're still trying to sort out what the research shows on that. So your packages, I don't think you have to worry about too much.
Nafisa, let me ask you this question. This is also a viewer question we got today. I think it's a great question because we're all already very hopeful that hopefully this will come to an end soon. What is the guideline to sound the all clear? A steady decline in cases?
Say that again.
So as far as like when this can all be done, as far as when this pandemic is over, when can we finally tell everyone, hey, you don't need to self-isolate anymore, you don't need to quarantine? What actually determines that by the World Health Organization, by the CDC? Is it a steady decline in cases?
Yes, so there's going to be a steady decline in cases, and so that's why we are urging our citizens and to help us with the prevention of staying at home when they're feeling sick, of cleaning and washing their hands, and also covering their mouth and cough. It's going to take all of us to be able to start to mitigate the spread of this disease. And so we really ask of all of you to be part of this with us as we continue to work harder together to ensure the health of the community.
And that's another thing you had mentioned during our last commercial break to us, is just the importance of everybody, you all are working together on this. So everybody is in good hands, all of the officials are working together, correct?
Yes, all the officials are working together. The healthcare system, in collaboration with public health, is working together. The community, this is the time to really be proud of your healthcare systems and your public health department. We have always try to build that strength in our coalition, in our meetings, and just being able to prepare for such a situation. And we are doing that. We are working behind the scenes. We are communicating with each other, and we are sharing information as rapidly as we obtain it. So I'm very proud of our FQHC, our People's Community Clinic, Mercy One, Unity Point. It's just a wonderful group of organizations and that are coming together and just doing their best to serve the community at this moment.
Sarah, I wanted to ask you, we were talking a little bit about the mindset that this coronavirus has brought on everyone and the mental health aspect of what's going on. So what are you telling people who are maybe in not necessarily a panic mode, but certainly has a lot of anxiety going through their minds right now?
I think the entire nation is just at a little bit higher level of anxiety than normal. And so with that, I think we're really telling people the social distancing does not have to mean social isolation. So you can still get on social media. We can learn from our millennials. We can phone, FaceTime. It's really, really important that you still have that social connection with people, even if you are needing to stay at home for 14 days. There are a lot of resources out there. I think it's important for employers to get your team members those resources. It's important for parents to watch the signs in their kids or in their their own parents. So it's just good that we all kind of take care of each other during this time of a little bit heightened anxiety.
Absolutely. Dr. Seiko, where are they now on a vaccine? I know a couple of days ago there was a report that they were testing a vaccine. Where does that stand right now, or is everyone hopeful?
I believe they are testing a vaccine in the Seattle area. I believe there were about 45 individuals that volunteered to go through the process. But that's the very beginning, and it can be a year or 2 years before we would have a functioning vaccine available for the community.
Dr. Seiko, just real quickly here too, something came to mind here about people handling actual money these days. That most of the bank lobbies are closed right now, but they're going to the ATMs. Do they need to be worried about our bank sanitizing that money, or do you need to sanitize it? What do you think?
I have not heard of any need to sanitize the money, but I've not heard that we shouldn't sanitize the money. So good hand washing is probably your best prevention for infection. After you touch money, wash your hands.
Well, maybe in this case, money laundering is a good thing. I don't know. Maybe sure. Okay. So there are several places you can go for key information, including, of course, the new Blackhawk County Health Department website, blackhawkcovid19.com. It's on your screen right now, so be sure to check that out.
And Dr. Seiko just mentioned this. Don't forget, wash your hands with soap and water for at least 20 seconds. If you cannot wash your hands right away, use an alcohol-based hand sanitizer with at least 60% alcohol in it. Of course, avoid touching your face with unwashed hands. Practice social distancing. And our panel discussion will continue right after this break.
Welcome back to our special program here tonight. We do have some good news concerning COVID-19 and the pandemic. So far, at least 79,000 people who have contracted the virus have fully recovered. Many others have just mild or moderate symptoms. As Nafisa pointed out, 80% of Iowans are expected to be in the mild condition category. People with other health complications may, though, not improve for up to 6 weeks. That's the uncertainty of this right now. We just don't know the volume of cases coming because healthcare workers in the health department at this point don't know what they're up against, really.
And we do have only time for one more question. I want to direct it towards Sarah. What are the hardest things that you're facing right now as a healthcare provider?
You know, you talked about trying to bend that curve, and so we're having to make a lot of really difficult decisions right now, and a lot of them are not satisfiers for visitors and for patients, but it's all in an effort to keep our patients healthy and keep our staff healthy. Visitor restrictions are something that we've had to move forward with, and actually canceling some of our elective procedures. We know people don't like that, but our intentions are very, very good.
All right, thank you very much. I'm really apologize. We're just out of time already. It just goes by so quickly. We've been covering this pandemic extensively now over the past several weeks, and particularly when it became a pandemic. So from the latest on the cases from Iowa, any questions you might have, we do have a lot of information that's available on our website on our special coronavirus tab at KWWL.com. You can find that tab right there on our homepage.
Also, we want to mention before we head out, don't forget the 211 number. Yes, there might be a long wait to talk to someone, but it would be worth the wait. Thank you very much for joining us for this coronavirus special here on KWWL. Have a good evening.